Hello, everyone. I'm Dr. Shashi Prasad. I'm a GP and VMS registered menopause specialist and a lifestyle medicine expert. I've worked in NHS and private for more than 14 years now, and I really appreciate this opportunity to do this talk with OMC. And I'll be talking about mental health issues during menopause and perimenopause. And thank you all for joining me. The topics I'll be covering in my talk is what are the causes of mood disorders during menopause? If there are any, what are the mental health symptoms? What are the risk factors which can be related? And what are the treatment options? So, menopause and perimenopause can have a significant impact on a woman's mental health. Women are often very aware of common menopausal symptoms, hot flushes, and night sweats, but they may not be aware of the potential changes in their mood and emotions. And a common word that I hear women say is, I was blindsided by perimenopause and menopause. And so the purpose of this talk today is to create awareness about perimenopause and menopause, what are the mood disorders, and what we can do to help ourselves. But before I start the talk, I would like to mention that severe menopausal symptoms or symptoms which require specialist input is not very common during menopause and perimenopause, and most of the women are actually all right. For example, regarding hot flushes and sweats, 75% of the women going through menopause transition may have hot flushes and sweats, but only about 20 to 30% require help. And same with mental health problems as well. So maybe about 20 to 30% of women going through menopause transition may have mental health issues or mood disorders that requires further input and help. So let's move on to what are the causes of mood disorders during what are the causes of mood disorders during menopause transitions. So if you look at the slide on the side, the image on the side, so you'll see that during the reproductive years, the estrogen, which is one of our main female hormones, go up and down, fluctuate every month during the menstrual cycle in a very rhythmic and cyclical way. But however, as we move into the perimenopause, that is the early part of the menopause transition, the hormones begin to fluctuate quite a bit. They can be highs, they can be lows, and they generally take a downward trend. And this is the time when the menopausal symptoms may start. So the changes in estrogen level is a very important contributory factor to menopausal symptoms and including mood disorders during this time. So the erratic fluctuations in estrogen level during perimenopause or very low levels in the menopause both can be contributory. The effect of estrogen on mood is quite complex, and research has shown that it has an anti-anxiety and an antidepressant effect. Estrogen also helps in the production of serotonin and endorphins, which stabilizes mood and helps create a feeling of well-being and happiness. One of the other hormones is testosterone. Testosterone is also a very important female hormone, and it has a significant impact on the woman's central nervous system and on the brain. The next hormone also is important, it's progesterone. The levels begin to drop in perimenopause, and it can also have an adverse effect on the woman's mood because it naturally has a calming, relaxing effect, and low levels may cause mood disorders. Then I would like to mention here insomnia. Obviously, insomnia is not a hormone. However, some women suffer from terrible insomnia during menopause transition. And it can be either they are unable to fall asleep, or the sleep is very disturbed, they keep waking up, or there is early morning awakening. And lack of sleep may worsen any mood problem. So let's move on to what are the symptoms we might expect during the mood disorders that we might expect during menopause transition. I have put on some of the common ones. However, this list is not comprehensive, and some of the women might experience some symptoms which is not here. So a very common one is mood swings. So you might feel fine one moment and then crying without reason the next. Women say that they do not have any control over their emotions, and often it's unexplained. Then they can be irritable, lack of patience, very snappy. Again, very common symptom. So women mention that while dealing with their young children, work colleagues, their partner, often they might be quite irritable and they could snap quite easily. Then there is anger, unreasonable anger. Seeing red is a common thing that women mention. That normally they would have managed to take the incident in their stride, but now they get extremely angry, out of control. Unexplained anxiety, feeling on the edge, easily overwhelmed, feeling not in control of emotions. And often small tasks might easily overwhelm women, and they might feel that they are unable to do things which they have normally done very easily. Then there's loss of confidence, lower self-esteem, and this has a huge impact at workplace. There are women who might have been in the job for 20 years, really skilled and good at what they are doing. But starting the menopause transition, they may begin to lose confidence. They may think that they are not good enough and that they might not be able to do the job as well as before. Then there is low mood, feeling of depression, lack of motivation, being sad, tearful, lack of interest in things. Again, a common menopausal symptoms. And in some women, they can have actually moderate to severe depression, sometimes even feeling suicidal. But thankfully, moderate to severe depression is quite rare to be actually just caused by hormonal fluctuations. And in these women, there might be some predisposing risk factors which makes them more vulnerable. And if they've got pre-existing mental health problems, then they might notice that during the menopause transition, the mental health issues might actually worsen. Okay, so there are certain risk factors that I mentioned that might make somebody more susceptible to worsening or onset of mood disorders during the menopause transition. So, for example, if somebody has pre existing mental health problems, they might have episodes of anxiety or depression on and off throughout their life. And these women might be more susceptible to hormonal changes. If somebody has had a history of postnatal depression or PMSs, again, the hormonal fluctuation and changes during the menopause transition can affect them more. If somebody has multiple health problems, if they've got joint problems, back problems, heart problems, dealing with anyways with a lot of chronic health conditions, and on top of it, if you add the mix of hormonal fluctuations, then they can find it quite difficult to cope. Or if there are multiple stresses in life, and very common during midlife, needing to look after children, older parents, working full time, these can all put them at a higher risk. Often it's very confusing to say about mood disorders regarding the cause why they are getting it, because often mood disorders are multifactorial, and it sometimes is difficult to assess whether the mood changes is just due to hormones or there are any underlying psychological reasons for that. Very, very common during COVID. So when I'm talking to women, they're saying, I don't know whether it's my hormones or it's COVID. I just feel so low. I feel anxious. But then, many people are anyway suffering from mental health issues, anxiety, depression because of COVID or some other reason. But if the mood fluctuation, then the antidepressants may not be very effective. That's important to know. And often women do get put on antidepressants, which they find is not helping them a lot. So to deal with mood disorders during menopause transition, I think we have to have an holistic, personalized approach, and we try and assess the causes in detail and try to get the best help possible. So, what I consider is menopause as a biopsychosocial process. So, it is not just due to hormones or one particular reason, but it's a combination of many things. So, it's biological causes. For example, that's the hormones we are talking about are estrogen, progesterone, testosterone, the falling levels of those. Then many women during menopause transition feel very tired, they are fatigued, they've got insomnia, and that can affect their mood. And then often one of the common symptoms is vaginal dryness or low libido, which can have an impact on sexual life, affect relationship, cause dissatisfaction, and cause depression as well. Then we can look at the psychological causes, psychological processes that might be going on. For example, if somebody has pre-existing mental health issues, or if somebody has, preconceived negative beliefs about menopause, for if they think that they're going to get old, they are not attractive, they're over the hill. So if there are a lot of preconceived negative beliefs, then women might find going through menopause transition more difficult. Then there are social factors. For example, there's midlife stresses, and often women find themselves in the middle of a lot of responsibilities and commitments. Many women might have young children, so they're 4, 5, 6 years old when they start the perimenopause. And we all know how difficult it is to look after young children. Or they might be helping their children look after their kids, looking after grandkids. There might be relationship issues. They might be looking after older parents who might be ill, who might have complex needs, or there might be a lot of work stresses. And all of this, the biological, psychological, and social issues combine together to have an effect on the mental health and well being of a woman during menopause transition. So, so can we do anything to help ourselves? Can we reduce the symptoms, or can we treat them? Definitely. So there are lots of options available, which are evidence based and to help with mood disorders during menopause transition. So the first one is the hormone replacement therapy, or HRT, or replacing the hormones that you have lost during the transition. And this is the most effective treatment to manage mood changes due to hormonal issues. So it can level off the hormonal fluctuations, it can raise the hormone levels, and it helps with anxiety, depression, and mood swings. And there is a role of estrogen, progesterone, testosterone, and DHEA, so dehydroepiandrosterone. So all of them have a role in helping with mood disorders. With estrogen, we know they work directly on the brain, and they help with the hormone levels stop fluctuating as much, and they get high and we feel better. The progesterone has a calming anti-anxiety effect, and it helps reduce anxiety. It also helps with sleep. Testosterone has a stimulatory effect. It helps with symptoms of brain fog, feeling very low, unmotivated, and with libido, and that all then help enhance mood. DHEA also has creates a feeling of well-being, gives the little perk to your life, and makes you feel a bit more better about yourself. Moving on to exercising, I think most of us know the importance of irregular exercising, and how helpful they are to help with anxiety and depression. And regular exercising helps relieve endorphins, which are naturally relaxing hormones. Especially exercising or walking in early morning in natural light does help a lot with low mood and also with sleep. The next one is SSRIs, or what you call as antidepressant medication or anti-anxiety medication. They do have a role in managing mood disorders. And for example, in some women in whom HRT is contraindicated, or if there is an underlying mood disorder which HRT has not fully resolved, especially with moderate to severe depression, it's noted, the evidence suggests that combining HRT with SSRIs has a better outcome than either of them on their own. Cognitive behavioral therapy, I think it's a really, really good approach towards managing mood disorders. Unfortunately, there are not many CBT therapists available at the moment, but there is a role of self-guided CBT, and evidence suggests that even if a woman does the self-guided CBT, they can have significant benefits from that, and it has a long-lasting effect. So what is it, CBT? So it helps to look at the way we think about menopause and how it affects the way we feel. It helps us replace negative thoughts with positive thoughts and make changes in our behavior to enhance our well-being. I'll show you a book. I'm reading the book at the moment. Sorry, I think you can't see that, but it's called Living Well Through Menopause. And it is an evidence based cognitive behavioral guide. And it's written by a leading researcher on CBT on menopause, Professor Myra Hunter and Melanie Smith. If you want information about the book, we can send that information out to you. And I would recommend women to read this book as well. And it gives a lot of tips how to understand your menopause, your perimenopause, and what CBT techniques you can do at home that will be helpful. And now moving on to the last point, which is again I feel is very, very important, not just for menopause and perimenopause, but our general well-being, is some self-care, giving time to ourselves, relaxation, meditation, and mindfulness, paced breathing exercises. And these techniques can help a lot to relax and cope with mood issues. They are not easy. I'll agree. When you're feeling very anxious and agitated, and if somebody asks you to sit down and try and calm and meditate, it's not easy, but it does require practice. And with practice, it is very helpful, and something that if that interests you, that can be looked at. Okay, so that is the end of my talk. I hope you enjoyed it, and I'm open to take more questions now. Thank you.